Services Administrator.
Good evening.
Good evening.
Can everyone hear me? It's a pleasure to be here this evening. Carrie did not tell me I was going to be filmed, and so I
I find it wiser not to let
12
me know.
hours since I got in the office. So anyway, when Carrie contacted me about 3 months ago and asked me to speak, I thought, I think I could share a lot about my experiences and hopefully give you some tips on how to effectively communicate with the healthcare providers and healthcare professionals. I've been in long-term care for over 30 years. My passion is caring for the older adults. So you name it, I've probably seen it. And really, it is my passion, and I'm pleased to be here with you. So I thought, as I see in my own experiences as administrators for all of you, begin with your family, whether your loved one resides with you in your home or whether they have your own home. There is a family. Clarify family member roles. Now, if you're the only primary caregiver of your loved one, it makes it a lot easier, but I think it also, we'll talk about some resources you can access, but really it's helpful if you have multiple members in the family that you clarify roles. Who is going to do what? And it particularly, all of this information is really helpful when you are faced with making decisions about transitions, whether it is a hospital stay, whether it is a rehab stay, or even back to your home. Who's going to do what? So that assists you with not feeling overwhelmed. Many families some are remote. There are still some things that they can do. So sit down with your family who is caring for your older adult, your loved one, and define the roles. Is someone in charge of managing all the paperwork? Is someone in charge of arranging support services? It's really important. Don't think you have to do it all yourself if you're the primary person. Have discussions with your loved one. Very, very, very important. Again, have it with family members that are also present, but really talk about what are their wishes, where do they want to go, how do they want to be treated, what are their advanced directives. And I know you had a session last week on that, so I'm not going to go into that, but really very important. It's going to alleviate a lot of stress and anxiety for you all to know what your loved one's wishes are. Please don't wait to the last minute. It's very important. I often see families coming in to Kendall Crosslands, and it just makes it really difficult, and it also makes it difficult for the healthcare providers, whether it's you going to your loved one going to the hospital, but really have those discussions. Role of the extended family member, and what I mean, there might be a close neighbor, there might be a close companion or just friend of the family. Include them in these discussions. I once had an admission to Crosslands, and the key was given to the house, was given to this extended family member role, who happened to be on vacation, and no one could get into the house and get the documents that I needed for an admission, and it was just it's just, it was chaos, and you really don't need that for yourselves as primary caregivers, and also for your loved ones. So really include anyone else who is outside of your immediate family, but is considered an extended role, in an extended role. Utilize supports. I would encourage you as well to utilize supports such as companion agencies. I will go through a number of supports offered through the Chester County Department of Aging. They are a wealth of resources, but really don't think you have to do it all yourself, and I really want you to think outside of that role. So it's very important that you get organized. Again, do it ahead of time. Very important for you to have documents accessible to you, know where they are. I suggest that you create a folder of sorts that you can keep very essential and critical documents with you, or where you know where they're located, so you're not scrambling to know where is the advance directive. Who has a copy? Is there one? Who is named on the advance directive? So begin to assemble some of these documents so that any kind of transition is a lot more seamless. And this will actually help you communicating with the healthcare provider, whether it's the admitting ER physician, or if you change primary care physicians or a specialist. Any of those will enable you to talk more clearly about what the questions and have answers to some of the questions, because they will ask you, well, what are the wishes? So have a copy of that. So start assembling that. It's amazing how often I will find that that is not readily available. So I talked about power of attorney, and I'm not talking about the financial part, although that's very important, but power of attorney for healthcare. Who makes the decisions for your loved one if your loved one is unable to make those decisions? Know who's on there. You'd be amazed how many people don't even know they're on the power of attorney for healthcare, because you are then named as the decision maker in the event. And when you have to make decisions about healthcare, asked by the healthcare professionals, you will have had those discussions with your loved one, and you'll know. Although it's a difficult time to make whatever decision, at least you'll be more confident in that. So make sure you have a copy of, get a folder, power of attorney for healthcare, advance directives, living will. Make sure they're current, that they weren't made a long time ago, and make sure they're valid. So pull them out, have a discussion with your loved one and say, you know, mom or dad or whoever it is, here's what you have on your advance directive. Is this, you still are on the same page as what says, what's documented? Because those things change as well. So that then if they change, or often successors, when they have more than 2 people on a document, sometimes the primary is no longer available, especially if it's a spouse and the spouse is deceased, and who is the successor. So make sure you have those documents available and that you've had those discussions. Insurance cards. Bill is going to talk about Medicare, but make sure you have copies of insurance cards. Front and back, Medicare, any kind of supplemental insurance. Front and back, because the back is where you call for benefit information and what benefits is under the plan. Prescription cards, make sure you have those. Make copies. Be amazed again through my experience, because if the loved one is, let's say, rushed to the hospital, their pocketbook is at home or their wallet, and the cards reside in the wallet, and you go and you have nothing. So put it all in one place, maybe make 2 sets, so that you have easy access to it. Executor often, sometimes is established or not, but again, it's something that you really want to have figured out and have those discussions about that. HIPAA releases. If you bring your parent or loved one to the physician, any physician offices, primary providers, get a HIPAA release so that at any point in time, you are already authorized to receive information from that office. You can do it now. If you go with your loved one, the next time, ask for a HIPAA release, because your loved one is going to have to sign that release. And if they're not well enough to sign that release, when you need that information, you're not going to be able to get it. So think about the primary care physicians, any specialists that really play an important role in the overall care of your loved one. Get those HIPAA releases done, and they all have them in the offices. So coordinating care, because you are really the primary caregiver, or you in a sense are the coordinator of the care. You probably get asked tons of questions when you go to doctor's offices, or if there's an admission to a hospital, they're going to ask you questions. So in that folder, very important, have a list of medications and why how much they're taking, dosages, and why are they taking the meds. Especially if there is a hospital admission or an admission to a facility like Crosslands. We want to know what were they taking at home before they went to the hospital, because the hospital, there's often many changes, and you want to be able to reconcile. So make a list of the medications, why they are taking them, because sometimes there is off-label use of a certain medication and the dosages. You'll be like amazing with information that you know. Diagnosis, primary diagnosis of medical conditions. Again, you can get that from your primary care physician, but often if you go to a specialist or another healthcare provider, they may not have that information. So you will be able to communicate with the specialist. My mom has, Parkinson's or AFib or any of those diagnoses, but really they're going to ask you, because you are more than likely going to be there. Make sure that folder is available for anyone else who may be part of that care circle. Allergies, very important. Make a list. What are their allergies? Especially, well, any kind of allergies, but There are many medications, as you may already have experienced, that have adverse drug reactions and because of an allergy. So again, that's something when someone comes into Crosslands for a rehab stay, we ask what are the allergies. Really, really helpful to know that. And again, if you go and you have to communicate with the physician, I communicate with physicians all the time. That's one of very, very important. Immunizations. Again, another, keep it in your folder, keep a list of when they're the last tuberculosis skin test, their last pneumovax, when did their big one is they're going to ask when did they have the flu vaccine last? Because you don't want to unnecessarily give these immunizations if they've had those within the required time. Primary care physician and specialists have the contact information. Again, if you go into an emergency room, they're going to want to know who is the primary care physician, when was the last time they were seen, but have that information, and also with specialists, because they honestly try to coordinate care if you have multiple specialists that your loved one is seeing, in addition to the primary care, you really serve as the agent or vehicle to ensure that that information is passed along. Physicians really try to coordinate that care, but to have you there and say, oh yes, my mother or my brother or whatever, the loved one, you have that information and you can talk very effectively with that healthcare provider. Past medical history. Make a little list of the primary diagnosis of their past medical history. Significant surgeries and when they have. Because in the rush, I don't remember all those things. It's helpful. It'll make you feel better if you have that written down. Do they have a frequent history of falls is also another example. But past medical history, very, very important. And a personal story or idiosyncrasies. Allergies also have to do with not only medications, but food. Very important, do they have a shellfish allergy or a strawberry allergy? Because you want to make sure when you have that all with you, you'll remember all those things. And you won't go home and say, oh, I forgot to tell them. Very important. So do yourself credit. You all assume a lot, caring for your loved one, and so make it a little bit easier for yourself. Personal story or idiosyncrasies, I think, very important so that any healthcare provider can deliver care that is person-centered and that it's very specific to your loved one. An example would be that my family member is going to stay up all night long because that's what they've done, and they're going to, they sleep late in the morning. And that is an example that is going to make your loved one feel much more comfortable wherever they are. And it's going to allow the healthcare provider to deliver care that is person-centered. Often the careers of your loved one, particularly where if they were early risers, like their career as a postal worker, they got up early at 4 o'clock every morning, and they've always done that, and so that having that information will enable, again, that provider of care to know that, okay, okay, this is a routine, this is a normal thing. And so any kind of personal idiosyncrasies, personal story that are important will be very, very effective. And I always ask for that when someone comes into Crosslands, because it's important to know the person and